In this podcast episode, Dr. Marissa Harrison, a prominent psychologist and author, delves into the complex and often misunderstood world of female serial killers. Through her extensive research, she sheds light on the psychological, sociocultural, and evolutionary factors that contribute to the actions of these individuals. Dr. Harrison begins by addressing the common misconceptions surrounding serial killers. In popular culture, the archetype of a serial killer is predominantly male, often characterized by figures like Ted Bundy or Ed Gein. This has led to a general neglect of female serial killers, who often operate in less conspicuous ways. Dr. Harrison argues that female serial killers tend to use methods such as poisoning, which are less sensational than the violent acts typically associated with their male counterparts. This difference in modus operandi contributes to the public's lack of awareness and understanding of female serial killers. The fascination with female serial killers is not merely a matter of sensationalism, it also reflects deeper societal beliefs about gender roles. Women are often perceived as nurturing and caring, which creates a cognitive dissonance when they commit heinous acts. Dr. Harrison emphasizes that this disconnect can lead to a lack of recognition of female serial killers, as society struggles to reconcile the image of a caregiver with that of a murderer. By bringing attention to these cases, Dr. Harrison aims to challenge preconceived notions and encourage a more nuanced understanding of female criminality. Dr. Harrison discusses the historical neglect of female serial killers in both academic research and media representation. She points out that while male serial killers have been extensively studied and sensationalized, female counterparts have often been overlooked. This oversight can be attributed to societal stereotypes that portray women as inherently nurturing and incapable of violence. As a result, female serial killers are often dismissed or their crimes trivialized, leading to a lack of comprehensive research on their psychological profiles. The consequences of this neglect are significant. Dr. Harrison argues that understanding the motivations and behaviors of female serial killers is crucial for prevention and intervention. By studying their patterns, researchers and law enforcement can develop better strategies to identify and apprehend these individuals before they escalate their criminal activities. Dr. Harrison's work aims to fill this gap in knowledge and bring female serial killers into the conversation about criminal psychology. In her research, Dr. Harrison has identified several common characteristics among female serial killers. She notes that they are often white, married, and in their 20s or 30s. Many have a background in caregiving professions, such as nursing, which provides them with access to vulnerable individuals. This demographic profile challenges the stereotype of the lone, deranged killer and highlights the complexity of female serial murderers. Dr. Harrison also emphasizes the importance of understanding the psychological factors that contribute to these individuals' actions. Many female serial killers have experienced significant trauma in their lives, including childhood, abuse, and neglect. This history of trauma can lead to a range of psychological issues, including personality disorders and mental illness. By examining these factors, Dr. Harrison aims to provide a more comprehensive understanding of the motivations behind female serial killers' actions. One of the key points discussed in the podcast is the difference in motives between male and female serial killers. Dr. Harrison explains that while male serial killers often kill for sexual gratification, female serial killers are more likely to kill for financial gain or power. This distinction is rooted in evolutionary psychology, where women have historically sought out partners with resources to ensure their survival and that of their offspring. Dr. Harrison's research indicates that money is the primary motive for many female serial killers, followed closely by a desire for power. This financial motivation often manifests in cases where women kill their spouses or family members to collect insurance money or gain control over their lives. By understanding these motives, researchers can better identify potential female serial killers and develop strategies to prevent their crimes. Dr. Harrison highlights the significant impact of childhood trauma on the development of female serial killers. Many of these individuals have experienced abuse, neglect, or other traumatic events during their formative years. This history of trauma can lead to a range of psychological issues, including anxiety, depression, and personality disorders. Dr. Harrison argues that these experiences can create a predisposition for violent behavior in some individuals. The connection between childhood trauma and serial murder is not limited to female killers. It is a common theme among male serial killers as well. However, the way this trauma manifests in their behavior can differ significantly between the sexes. While male serial killers may act out their aggression through sexual violence, female serial killers often resort to more covert methods, such as poisoning. By examining these patterns, Dr. Harrison aims to shed light on the complex interplay between trauma and criminal behavior. Dr. Harrison discusses the various methods employed by female serial killers, emphasizing the prevalence of poisoning as a common technique. Unlike their male counterparts, who often use more overtly violent methods, female serial killers tend to choose methods that allow them to maintain a facade of normalcy. This can include administering lethal doses of medication or using household poisons that can be easily concealed. The choice of method is not merely a matter of preference, it is also influenced by the social roles that women occupy. Many female serial killers are caregivers, which provides them with access to vulnerable individuals, such as children or the elderly. This access allows them to commit their crimes without raising suspicion. Dr. Harrison's research highlights the importance of understanding these methods in order to identify potential female serial killers and prevent future crimes. Dr. Harrison explores how societal perceptions of gender roles influence the way female serial killers are viewed and treated. Women are often seen as nurturing and caring, which creates a cognitive dissonance when they commit violent acts. This disconnect can lead to a lack of recognition of female serial killers, as society struggles to reconcile the image of a caregiver with that of a murderer. The impact of these societal perceptions extends beyond public opinion. It also affects law enforcement and the criminal justice system. Female serial killers may be treated with more leniency than their male counterparts, as their actions are often viewed through the lens of their gender. Dr. Harrison argues that this bias can hinder investigations and prevent justice for victims. By challenging these perceptions, she hopes to promote a more equitable understanding of female criminality. Mental illness is a recurring theme in discussions about serial killers, and Dr. Harrison emphasizes its significance in the context of female serial killers. While a higher percentage of male serial killers are diagnosed with mental illnesses, Dr. Harrison notes that a substantial number of female serial killers also exhibit signs of psychological disturbance. This can include personality disorders, depression, and anxiety. The relationship between mental illness and serial murder is complex. Dr. Harrison argues that while mental illness may not be the sole cause of violent behavior, it can contribute to a person's propensity for violence. Understanding this relationship is crucial for developing effective prevention and intervention strategies. By addressing the mental health needs of individuals with a history of trauma, society may be able to reduce the risk of future violent behavior. The podcast also touches on the role of media and culture in shaping public perceptions of serial killers. Dr. Harrison notes that the sensationalization of male serial killers in popular culture has contributed to a skewed understanding of criminality. Female serial killers, on the other hand, are often portrayed as anomalies, which can further perpetuate misconceptions about their motivations and behaviors. Dr. Harrison argues that this media portrayal can have real-world consequences. By focusing on sensationalized narratives, society may overlook the underlying psychological and sociocultural factors that contribute to female serial murder. This can hinder efforts to understand and prevent these crimes. Dr. Harrison advocates for a more nuanced approach to media representation, one that emphasizes the complexity of female serial killers and the factors that drive their behavior.